Hey guys, I'm Sebastian at Performance Play Sports Care in Costa Mesa. I'm going to help you guys with golfer's elbow today. It won't be necessarily treatments that I'm going to show you today, but we're going to cover signs, symptoms, and the progression treatment, what you should typically see with this. What does it look like that you're going to have to do? If you're looking for the actual videos of things that we do for golfer's elbow, you just subscribe to the channel. It's in a little link, a little circle somewhere, and there's a search bar that pops up, and lo and behold, you can put in golfer's elbow, and it'll go over all the stuff that we do. Probably not in an organized format, to be honest with you, because it is YouTube and people watch videos however they want to in different orders and so on. And so with a good program, you need to have progressions, okay? And stay tuned to the very end of the video and I'll explain progressions and what to do next. So the first thing is golfer's elbow is something that most people won't have a traumatic experience with. You won't slip and fall, you won't hit something wrong, you won't feel a pop, it'll just all of a sudden start to creep on you. It's common. And the funny thing is that a lot of people say, well, I don't know what I did. And I mean this in the nicest way, it doesn't really matter what you did that much. It matters what makes it feel better now, okay? So I would encourage you that when you have it, it's important to know what happened, what might have caused it, but it's more important to know what to do now. And when you spend time doing one, you don't always get to do the other. So golfer's elbow is usually in the inner part of the elbow. It's right around, not here, but it's here, okay? If you take the crease, you move up about 1/4 inch or so, or about an inch, and it's right around this area. By the way, it's important to note that if you have numbness of the fingers of any type, this is not golfer's elbow. This is going to be an ulnar nerve issue of some type, whether it's from the ulnar nerve itself or if it's from some other spot where it starts up, because it goes all the way up and starts in the neck from different nerve roots. By the way, this is very treatable. You don't need surgery for it. You need to do the right thing. And we do these virtually as well many times. They're very simple to treat. They just take a little bit of work on your part. Golfer's elbow is actually a little bit harder to treat when you really do have a tendon issue right here. So a lot of times people will have pain with gripping, with twisting, and especially resisted movement. And so things like kind of going down and then trying to push up, okay? You have to do this with the elbow fixed versus extended in many cases, but you can try it with the elbows extended too, and you can just kind of high on the hog here like you're riding a Harley, and just put your hands on like a table, and then try to push down on the table, and that's a good indication of something going on here if it bothers you. Signs, a lot of times it will be worse in the morning for people or after doing the activity that bothers them, okay? I know in the past a lot of people thought, well, this is from a repetitive stress injury, things like typing and keyboarding and so on. I don't necessarily think that's the case anymore. I think it happens to be referred in those cases. I have guitarists that come in who have poor posture and it ends up coming from their neck, it ends up being referred. I have pianists that come in that, again, a lot of sitting, it goes away when they stand up. And so that's an important note in this, that if it hurts when you sit, but you stand up and walk around and it goes away, this might be related to something else, okay? It's not necessarily just elbow related or tendon related. However, golfer's elbow traditionally is an irritation of the tendons as they insert it into the common flexor point. And so that comes from all the fingers and some of the wrists, and it goes down, and everything that produces this movement inserts mainly into this area, okay? Now, treatment-wise, I'll tangent off on a couple things here. Number one, if you have numbness and tingling in the area, you should watch some of our videos on ulnar nerve, which cover this way more extensively than I will in this video. But for the most part, if you have a nerve aspect to this, you have to treat the nerve first. And I would start at the neck, and I move our way a little bit down if you need to. It doesn't mean you have to do anything too aggressive. You don't need to have medication. You don't need injections. You don't need surgeries in most cases. And it usually requires you just do a little bit of TLC to the spine, okay? Sometimes it requires some stabilization around the area, like working the deep neck flexors and making sure the shoulder, which sometimes people are like, oh yeah, I dislocated the shoulder in the past, or I had an AC joint separation, or I had a rotator cuff or a labrum on that side. And so a lot of times the shoulder is not holding its own, and it's pressurizing the nerve as it goes down a little bit. So usually people need, number one is they need a first aid for the nerve, which is very simple to do. We have it in some of the other videos we have. Search our channel. Second is they need to build support within the strut here, within the shoulder blade. And a lot of times that reduces the problem very dramatically for them. But if we're actually looking at an elbow here, we have what we call a progressive loading. And so after the initial issue, if this is the first time you ever had it and it's the initial issue you ever had, I'll say it's the first time. We're going to wait 5 to 10 days and just do less, okay? And we're going to cool it down, and then we're going to do more, but progressively. And so a lot of times people will grab things like resistance bands and things of that nature, and they'll start to go gung-ho, which isn't necessarily a bad idea, but it'll flare them up sometimes. And so they've gone from doing nothing to doing a lot. And so the standard of practice with medial condylitis or golfer's elbow is progressive loading. Now, what does progressive loading means? Well, it doesn't mean doing 5,000 reps of something when you haven't been doing any. It means do something. Now, I have a good friend who explained this very well. He said people in this situation who don't do anything don't tend to get better. People who do too much tend to flare up, and then there's a sweet spot. And the only way you find the sweet spot is to go somewhere in the spectrum. You might overshoot it. It happens. But if you don't do anything, the tendon will not remodel. Okay? Now, some of the exercises I like to do is the use of a baseball. I like things like gripping exercises for this, especially farmer's carries, rows with a baseball, and just changing grips. Lobster carries are really nice. Now, you might wonder, what are all these things? We have some of them available on our channel. But to be honest with you, these are what we call corrective exercises. They're intended to correct something. And so a lot of times they require coaching. The exercise itself is nice, but the magic is in how it's coached and how it's biased, okay? The magic is in the coaching and teaching and how you retain it. So if you want some help with this, get the free guide that we have, okay? And we have a free gift with every video that we're producing, at least of this year. And we're trying to make it so you guys have a second step of things to do rather than just stopping at this video and jumping to another video, which might be 30 years old and has old information. I want you to continue down the route of the new information, okay? This is the newest, most relevant information that we have. We're very good at treating inner elbow pain, golfer's elbow, and nerve stuff. They're really very simple, but people over and over again, they end up having, they do the wrong thing when they do it on their own. So you need a roadmap, okay? So get the link, or go to the link in the description below. Get the free guide that we have for you. And if you want us to work with you one-on-one, we are locally world famous. That's a joke, trademark now. Costa Mesa chiropractors, and we can work virtually or in person. We don't need to adjust you to make you feel better. We just need to show you the right thing to do, okay? And so we are very, very good at helping people virtually. So let us help you. Reach out to us. We'd love to do what we can to get you on the right road. See you soon.